Hello and good day. Welcome to METCI Institute. Today we're going to start off with Chapter 1, EMS Systems in Public Health. My name is Jeff Gilliard. I'm your program director, and let's get started. All right, so a little bit of introduction about EMS and where we're at as far as this particular chapter is concerned. Traditionally, EMS is a team, plain and simple. It's a team of healthcare professionals that are dedicated to helping others in their community in their time of need. It has really evolved over the years. It has become truly a versatile mobile community health resource in so many different ways, both on ground and air and also in the sea. Plain and simple, they're out there to help to prevent and treat acute illness and injuries with professionals such as EMTs, first responders, paramedics, even nurses and doctors being involved in the continuum of care of the patients that are brought into the hospital, which we're going to address further in this chapter. Not every call for care will involve life-threatening emergencies. Truly, only about 10 to 15% of the calls that are run on a daily basis in any systems truly are life-threatening emergencies. Most of them are what we call basic, that require basic care, basic support, and getting the patient to the hospital. Most important is your success in this program is to remember that you always serve as a caregiver. You are there at the time of somebody's either best day or worst day. Best day being the birth of their child, and you're there to assist mom with delivering that child, or obviously on the worst day, the loss of their loved one, or if they're in a life-threatening kind of emergency. It is very important not to judge patients. Your compassion and kindness and gentleness and professionalism is what's going to shine through to your patients. It's a make or break. And remember, you only have one time to make that first impression. So we're going to talk a lot about being professional, professional dress, making sure that you don't look like a pirate when you come up to grandma there having a heart attack. You might just push her over to the edge. So let's not do that. We're gonna talk about those things. All right, so purpose and history of emergency medical services. As an EMT, it's a long tradition of EMT and EMT service. You're going to join a fellow group of like-minded people that provide emergency care to people within their community. With EMS, we know that today, you read in your book, it originated in 1966 with a specific paper that was written called The Accidental Death and Disability, the Neglected Disease of Modern Society. What this was all about is folks that were out in the community getting hurt and nobody was there to help them. So Congress passed legislation that created what is now called, originally it was called Department of Transportation, but it moved to the National Highway Transportation Safety Administration, NHTSA. Folks, that is a test question. DOT is not what writes, who's not who that writes the curriculum, it's NHTSA. Truly, a high number of preventable deaths happen here in the United States, especially out on the road. You get a lot of people that bleed to death on the side of the road because nobody will stop and help them. Our job is to make sure that we know how bad these patients are when we get there and how we're going to help them. All right, so Freedom House Ambulance. It's one of the first known ambulance companies that we know of that served in Pittsburgh. 1967 was the year. Look at this, it's a van, just a common van with no high top, nothing special. You'll see that the ambulance attendants are wearing white pants. The last thing you want to wear on a call where there's lots of blood. And basically what happens, it serves as a blueprint of who we are and what we are and how we're going to respond. Their medical director at the time was Dr. Nancy Caroline, who wrote all of these books, now on its 13th edition, that's amazing, totally amazing. I met her at a conference one time. She's a very great person. Um, anyhow, it's, long service, long time, having served EMS since around 1979 when I got my first responder. Has been an honor to meet so many different great people during my tenure as a paramedic. Standardization. We knew that we needed to standardize things, plain and simple. Uh, People were doing things all over the country as we grew uh, differently, and we didn't want that. We wanted something that was unified. So, National Registry of EMTs was established in 1970. The Department of Transportation at that time, now called NHTSA, developed the first national standard curriculum in 1971. The American Academy of Orthopedic Surgeons published Nancy Caroline's first EMT book in 1971. Over the years, it's grown. The 1996 EMS Agenda for the Future proposed a new vision of EMS and who we are and what we do. As a paramedic, I can tell you since my first tenure on the streets in the early 80s, 1981, 1982, things have changed drastically, very, very drastically, which ultimately led us to the national EMS standards. And I want you to remember that ultimately, when you are tested by National Registry to become an EMT, it is going to be based on those national EMS standards. You can find those standards in your book at the beginning of every chapter of Nancy Caroline's book. Right at the top, it says National Standard EMS or National EMS Education Competencies. That is what you have to know to pass National Registry. They got page numbers and everything right there for you to find. And just below that's your knowledge objectives, which has the same page numbers, just more expanded view of what you're going to need to know to complete the program. National levels of EMS training. Through the scope of practice model, we've developed different clinician levels. That National EMS Education Standards not only develops those levels, but also it shows what their knowledge and what their competencies are. EMS courses are competency based. Competency based. Back when you went through K through 12 courses in junior high school, and obviously elementary school, it was about knowledge base. It was being able to read a book and see that spot ran down the road, and then be able to describe that spot ran down the road on your test. In EMS, it's a lot different. You'll end up getting a scenario with options, and you have to choose which is the best option for the patient that matches scenarios. So it is competency based, and all of what we do is based on research, and we're going to talk about that here very shortly. The first responder is the first level, that is the EMR. EMRs usually support the EMTs on a basic life support unit by driving the ambulance, getting from one place to another, and they function at a BLS capacity with the EMT providing the patient care. So it is, it's basically, you can start off with first aid, like if you were in Boy Scouts or Girl Scouts, and you move from there, excuse me, you can move from first being a basic first aid provider to EMR. We give you the entry level to being an EMT. It's a great program. We teach it a lot in high schools, and we're even teaching EMT school in high school now as well. The EMR does provide skills to initiate immediate care, call for additional resources, and work with other EMS professionals. The EMT, another test question. You need to know the differences between these. The EMR usually is not licensed in a state. It has a national registry recognition, but EMT is usually the first certificated or licensed qualification or provider level in the United States, in most states. Quickly assess the patient. They provide immediately stabilized measures, treating and identifying and treating life-threatening injuries. They have the basic knowledge and skills to provide what's called basic emergency care. On arrival, the EMT assumes responsibility for assessment, care, packaging, and transport. If they're in at BLS capacity or in in a BLS ambulance versus BLS meaning basic life support, ALS meaning advanced life support, it requires a paramedic or an advanced EMT. Those are two different types of ambulances. The EMT may also serve other roles. It could be a member of a patient care team in a healthcare facility. A lot of students that graduate from EMT schools, they go to work for urgent care centers or they go to work for a doctor's office. There's so many opportunities, even in the hospital, in the emergency department, doing patient transport and basic care. Lots of opportunities. But this is that ground floor of your way into medicine, emergency medicine specifically. Seeing a lot of doctors start as EMTs. So yeah, and just work your way up. So advanced EMT is another level that's provided in some states. Particularly, it's not here in Florida, but it is provided in so many different states. And what it is, it's where the EMT, the basic EMT, has gone through a little bit more training, and they can do some additional things, such starting IVs, using certain advanced airway adjuncts, and very limited administration of certain medications. Then you have the paramedic. Paramedic programs are generally 1 year long. Here in the Florida, it's required to be 1,150 hours by the Florida Department of Education, and the EMT is 300 hours. So generally, the paramedic students spend a year with us, and their focus is on both BLS and ALS assessments and treatments. You always have to start with the BLS first. The BLS is an essential component that just doesn't go away. So again, the paramedic does both BLS and ALS assessments. They do both. Courses may be offered as well as a degree program. I know here in our school we have an articulation agreement with Columbia Southern University, and you can actually transfer your paramedic credits towards an AS degree and a BS degree in Columbia Southern. So training covers a wide range of ALS skills, advanced life support, to include advanced airway management, pharmacology, cardiac monitoring, and understanding cardiovascular medicine, respiratory medicine, and pretty advanced pathophysiology and anatomy physiology. So advanced assessment and treatment skills are what the paramedic covers. Paramedics may also work in non-emergency and community-based settings. They can also work in hospitals, urgent cares, utilized offshore, utilized overseas on certain contracts, DoD contracts, DOJ contracts, DOS contracts, those kind of things. So a lot of opportunities once you get into emergency medicine. Let's talk about the next one, becoming an EMT. That's what you guys are going to do. Education and training, you have to you have to complete the entire course. Initial step is acquiring critical KSAs, which are identified as skills to serve as an EMT. It covers practices and skills identified in the National EMS standards. Information to perform those skills, outline the National EMS scope practice model, and any additional help that you may need. These are kind of things, the key skill assessments, they absolutely put you where you need to be to understand how to be an EMT. It's vital that you complete the readings in the assignment. Let me tell you something, folks. If you think you can pass this class without reading the book, you're wrong. You will fail. I told you that in orientation. I'll tell you that again. You must read your book. You need to focus in on multiple key areas, and the first one being the knowledge objectives. Each one of those knowledge objectives can be found in the very beginning of the chapter. It tells you the question or the knowledge you need to have, and it gives you a page number. Go find that question, get the answer, highlight it, and know that you're going to be tested on that particular piece of information that you could be. You also need to know the vital vocabulary that's in the back of every chapter. If you don't know what pericardial centesis is, or cardiomyopathy, or arthritis, if you don't know what these key vocabulary words are, you're not going to know what you're reading on the test, so you will get it wrong. You have to do the work. You have to read. Candidates must also successfully complete your certification, licensure, and credentialing process to work as an EMT. So in school, you have high-stake exams that you must complete with a certain grade point average that the state requires. And then at the end, you will have to take an examination that is required by the state that you're in. Specifically here in Florida, you take national registry, and that once you pass your national registry is what the state of Florida uses for their exam. You'll give your state national or your national registry certification information to the state, and the state will issue a certificate to work here in the state of Florida. So let's keep going. How it's done. Basically, it's modified from the National EMS Scope of Practice model. If you look that up, EMS Scope of Practice model from NHTSA, and here's the email address, or not, sorry, not the email address, the website address right there. You'll find that it focuses on 5 individual components. Trained to do so, certified as being competent, getting your state license to practice, getting credentialed by a medical director. And all of this revolves around an individual may perform only those procedures that you have been educated and certified to do. Now, the medical director may give you some additional training that's authorized under your scope of practice, and that's his or her prerogative, but this is the ground floor scope of practice, and you can find this information and look it up on your own. All right, so certification. Once you get your national registry, you can get certified in the state you're working in. The national registry has an EMS ID number. It's a 12-digit identification number on there. EMS IDs do not change as certification level changes. So when you become an advanced EMT or a paramedic, you keep that EMS ID. You're just getting a higher level of certification. So after you pass your certification exam, you're eligible to apply for state licensure or certification. Here in the state of Florida, you are certificated, not licensed. Some states do have licensure, but not all states. Licensure is the process by which the states ensure the applicant is competent. So whether it's a certification or licensure, it's the state making sure that you're competent to practice within their state in the level of care that you're able to provide. So, credentialing. This determines that the authorized clinician is able to perform a skill or a role. So, your credentialation comes originally from the school. We verify to National Registry that you're competent in performing the skills as an EMT, and we validate with them so that you can take a test. There's also some local and regional processes that when you go to work, your medical director may want to interview you, your fire chief, those kind of things. These are typically directed and overseen by the medical director. EMTs may be specifically credentialed to do certain things. In some places, here in the state of Florida and other states, a medical director has authorized additional training for the EMTs so that they can start an IV. Pretty neat stuff, aggressive, so it's very, very helpful. All right, so roles and responsibilities. This is, 2 different slides. Basically what this is it's every single piece, or at least a big part of them, of what is going to be required of you. Being ready for the call is the biggest thing I can tell you. When you get to work, you got to be in the right frame of mind. You got to be fit for duty. You got to be well rested. You got to be ready to take on the day, no matter what it throws at you. Some days it'll be, relaxed and nice, no problem. Get a couple of calls. Other days it could be pandemonium, where you run call after call after call after call. So you have to be prepared to do all these pieces of the operation. As an EMT, especially if you're on an ALS unit, your primary job is going to be to drive the ambulance. If you're working on a fire truck, you may be an engineer, you could be, in different positions, and you would fulfill those roles, whatever it is on the engine or on the rescue, if the department has a rescue. But these are some of the things that are straight out of the book that you'll be able to provide. Here's another page, just like the last page. This is another expansion part. It gives you another 11 total. In total, we've got 20 different things that they've identified within your book that are your responsibility. So professional attribute, you gotta be in a good frame of mind. Look at the smile on this girl's face. She's very, very happy. She's putting on oxygen onto the patient. Look at how she's dressed. Her collar is buttoned up. She's wearing a Class A uniform. She has her stethoscope around her neck. Make sure that you have a watch on your wrist, which I'm kind of looking. I don't see one on her wrist. Oops. Anyhow, you better not come to class without a watch. It's a watch that has a second-hand sweep on it so that you'll be able to count pulse and respirations. We'll be talking about that as we go through the program, and we also told you that in your orientation. Attitude, behaviors, being prepared, being mentally ready to go, being happy, being an active listener. These are all attributes of the EMT. One of the things that we want you to remember as an EMT is the EMT creed: do no harm. So when you come to work, you got to have that in your mindset. You don't come to work when you're sick, because you could do people harm. If you're sick, you could spread that to somebody else. So it directly applies to your EMT creed. All right, other attributes: integrity, empathy, self-motivation. Let me tell you something. If you're not motivated, especially as a student, if you go over there and sit in the corner and don't engage the EMTs and the paramedics at the station, then they're not going to see you worthy. You're there at the bottom of the ladder. You're a student. You're beginning. You got to have some motivation. Your appearance has to be good. Your hygiene has to be good. You've got to be confident. Don't be afraid. We're going to help you get through, especially that in the first 2 or 3 weeks when you're going to your clinicals to begin with, starting with the medical examiner. You got to see dead people, because you'll, in your career, staying here long enough, you will see a lot of dead people, and you may actually facilitate and help somebody die because you lose people. It does happen. Time management. Be early. Be early, at least 15 minutes early to any clinical. Do not show up late, because more than likely they're going to tell you to go home. That's inappropriate. That's one of those big faux pas. Do not show up late, and don't sit in the recliners. Be over there where they'll say, where can I put my stuff, and where would you like me to sit and study in between calls? Because that's what you should be. And then one of the things, if you take the initiative, ask about, hey, can I help you guys check out the truck? They're going to see you as, okay, you're motivated and you're engaged, and they're going to give you a whole lot more personal attention than if you just sit around and do nothing. Communications, understanding of others, and making yourself understood is very, very important. Teamwork, respect, patient advocacy. You are an advocate for the patient. If the patient's cold, go get them a blanket. Those kind of things. Don't ever give somebody something to eat or drink. Don't ever do that unless it's appropriate. And the nursing staff or the paramedic staff or whoever has directed you to do that. Do not do that on your own. Most patients, as individuals, once you start mixing with patients, will treat you with respect. Others may not. Others may be angry, or they may have had a bad experience, or they've been waiting for your ambulance to arrive for a couple hours. They may have an issue with that. So, approach with caution. EMTs are bound by patient confidentiality. It's called HIPAA, Healthcare Portability, Accountability and Portability Act. You must keep the patient's information, personal health information, PHI is what we call it, confidential. Findings or disclosure made by the patient should only be discussed with those that are treating the patient. In limited situations, sometimes you can speak with law enforcement, police, or social agencies to give information, but you need to refer to your paramedic if somebody's asking you questions. All right, so the overview of the system: emergency management, public health, public safety, and healthcare. It's an integrated continuum of care. EMS operates as an intersection of healthcare agencies. EMS is uniquely integrated in each one of these. EMS Agenda of 2050, okay, this is new, all of this is new stuff, is a people-centered EMS system. Working together, comprehensive quality and convenient care for our patients and our communities, evidence-based clinical medicine. It's the way it should be. Everything comes from research. To make sure that everything is safe with the transportation and the treatment of your patients, holistic care that reduces physical, emotional, and psychological suffering is part of that. Comprehensive and easy access to EMS, big time. And then comprehensive expert systems reporting prevention, or supporting prevention, diagnosis, and also treatment. It does continue on. It's inherently safe. Okay, it's effective. It's designed to minimize exposure, injury, infections, illness, and also stress. It is a seamless integration with other aspects of healthcare and other emergency services. It's reliable and prepared. It has refined itself over the past 40 plus years, 50 years. Goodness, I have been in it for over 45 years now. It's amazing, what we've seen, myself and other people still in the system on how things have changed. And it's changed for the best, and it changed for our community because we're public servants. We want to serve our community. Socially equitable, so everybody has access to health care. Also sustainable. It's got to be sustainable. It has to be cost effective. If it's not, people can't pay for it. Systems can't pay for it. It's got to be adaptive and also innovative. New ideas, new thought processes, and you folks are going to be on the cutting edge for the next 50 years. So everything that you learn and you see that maybe could be different, share that because that's how those innovations and adaptability come along. All right, so how does it work? Legislation and regulation. Well, you have here in Florida, Florida statutes, 401 specifically, that covers EMT and paramedic and transport and training, those kind of things. Then we also have the administration code. That's Florida Administration Code, or FAC 64J. These things you need to know. You need to look them up. So again, Florida Statute 401, Florida Administration Code 64J. It's available on your dashboard. You'll be able to click on it, and I would suggest you go through and read it to make sure you're familiar. In most states, the EMS office obtains input from advisory committees. We have an advisory committee here in the state of Florida. We meet once a quarter somewhere in the state, and they're open to the public. You ought to try to attend one day. Seek it out through the Florida EMS. It's called the Bureau of Emergency Medical Services of Florida. So seek it out. Public access. Everybody needs to have access. We have 911 here. 911. Back in the old days, you had to call the switchboard and tell Elsie on the switchboard that you needed fire and police and somebody send me an ambulance. And then she'd say, "Where at?" I said, "Well, it's down at Fred's barn." Where's Fred's barn? Well, you take old Southie Road there, and there's a dead horse over there behind the fence at the corner of the where the tractors broke down. And if you just turn right there, you'll find us. And yeah, that's it. Yeah, that's pretty much so what it was. It was quite interesting. And now they can pinpoint through GPS and satellites exactly where you're at. Most of the times they can actually even zoom in and see you on one camera or another, or some kind of satellite device that, satellite that's floating around that can zoom in as well, can see you for a period of time. It's amazing how it works. Public BLS and immediate aid. So how does this work? Millions of lay people have been trained in CPR and trained in first aid procedures and stop the bleed. If they get involved before we arrived on an ambulance, that's awesome. Saves a whole lot of lives. We also have automated external defibrillators, AEDs. You may have seen them if you traveled in an airport. You can see them hanging on the wall. They say AED. You may have also saw a stop the bleed kit as well. Those are really neat. They're hanging on the wall in a lot of schools, in most schools. I think pretty much so by the end of the next year or two, they will be in all schools. I know they've been mandated by our governor here in the state of Florida and many other governors in other states. Agency and personnel responding. Shoot, they're the key components. Okay, fire, police, utility workers, the ambulances, first responders, CERT programs, all kinds of stuff. Lifeguards were all integrated together. And who takes care of saying what we can and we can't do? Medical oversight. It is a physician. It is a physician that is a medical director that authorizes the EMTs and paramedics to provide medical care in the field. So appropriate care is described in written standing orders and protocols. Standing orders are part of protocols that designate what an EMT is allowed to do for a specific complaint or condition. You have patient has chest pain, you do this. Patient has a broken leg, you do this. Clinicians are not required to consult medical direction before implementing standing orders. That's what they're there for. Medical oversight is provided either offline or online. Online, hey doc, you're on the phone with them. Hey doc, I need to do something. Would you let me do it? That's online. Offline, let me look at my protocols and read what it says. Okay, it says to put a splint on. That's offline. Don't get those two mixed up. These are test questions. So online is direct, offline is indirect. Most systems have to enter patient care information into electronic patient care reports. Folks, you're going to hear a lot from me on how you write your PCR reports. Currently, we use Planner, Platinum, Platinum Planner, and all of our reports go in, and I review every single one of them, and you'll get feedback to me. You have to follow the rules. If you don't follow the rules, your reports are going to get kicked back to you, and then a process will ensue to make you comply with the way these are written. Why is this important? A lot of reasons. One, it provides a documented, both soft copy and hard copy, of what you've done for the patient and how the patient responded to it. It's what is the foundation of research of taking care of patients. It also approves a record of your education, and that record can be subpoenaed at any time. So you're going to hear a lot from me about this. It's very, very important, and you're going to also see in the test and those kind of things, and everything that we do, that your documentation is very, very important, and it's going to become an important part of your life once you graduate. Because if you don't do good documentation, your ambulance company you're working for, the fire department, the city, the county, whatever, will not be able to collect from the insurance because you didn't spell it out. And then if you end up in court, the lawyer says, well, did you do this? And it said, well, refer to my chart. And then they look at your chart and they say, well, you only documented 3 lines and this patient died. That's all you did? We're going to ask a whole bunch more questions and put you on the spot. Not good to be on the spot. You'll end up losing. Quality management. Woohoo! It's how do we improve, okay? EMS systems, we constantly work on becoming safer, more effective, better. This is how we've gotten to where we're at today, delivering high quality type of care, and it's all evidence-based. The National EMS Quality Alliance, or NIMS-QA, was formed to develop evidence type-based management. This collects a lot of data, how long it takes a new paramedic to start an IV or intubate or get the correct medicines, how long it takes for an EMT to make decisions on whether it's life-threatening or not life-threatening, all kinds of points that helps us to improve how we deliver education and what you're doing for your patients. So let's talk about EMS research. As I've said before, it is super, super important. Everything that we do in the field drives how we change medicine. All aspects of healthcare today incorporate evidence-based medicine. It focuses on procedures that have been proven that they work, plain and simple. Many EMS systems consult the national model of EMS clinical guidelines that were developed, that, hey, this is how research is supposed to be done. And this is the information that we are looking for. As an EMT, you'll be gathering data on every call, and you put that data in your electronic reporting. That's where they end up getting that information from. All right, so EMS and public health, how do they come together? Social drivers of health and health equity. They are plain and simply, we work under the public health model. EMS is under usually the Department of Health in the state that they work in. Public health examines the health needs of the entire population with the goal of preventing health problems. Specifically for us, it's EMS emergencies or death and disabilities from pre-hospital emergencies. A person's overall health is also influenced by non-healthcare factors such as social drivers of health. Drinking, economic stability, education access, quality, healthcare access, those kind of things. Anything that we can do to improve how we deliver those healthcare models. So, mobile integrated healthcare. This has become a new philosophy. Originally started, the models that I'm most familiar with as the earliest models is the Alaskan model. The community healthcare practitioner, which paramedics go out and they check on people in different villages. They have to fly out to them, make sure to run clinic for a few days, and make sure that everybody gets the healthcare they need. Basically, what it is delivering healthcare using pre-hospital care resources. So EMTs and paramedics will go check up on Aunt Edna because she just got discharged from the hospital 2 days ago after having pneumonia. So we want to go make sure that she's okay. Healthcare is provided within the community rather than at the physician's office. If they don't have to be drugged out of their home to the doctor's office, it's a lot better for the patient. It offers access to healthcare also within communities that may have very limited access to the hospitals and those kind of things and other healthcare resources. In addition to the patient care services, a paramedic would typically provide services provided in that community healthcare setting. They perform health evaluations, monitor chronic illnesses and conditions. They even draw labs and laboratory samples, and they can even administer immunization and other therapies that the medical directors approve. So, health surveillance, public health surveillance. This is information from patient care reports. Okay, it's the information that you write in the patient care reports. They are looked at EMS clinicians to find out where are all the serious and widespread problems. That EMS data is then used for what we call surveillance. One of the big topics over the past few years has been infectious disease and overdoses from opioids or narcotics, the heroin and fentanyl, those kind of things. How can we see that coming? How can we prevent it? So it comes through surveillance and looking at the presence of overdoses in certain geographic areas and how can we focus on preventing those. So prevention and education, primary focus of public health arm of healthcare is prevention. You're going to see on your tests primary and secondary preventions. Specifically, what is a secondary prevention? A primary prevents on the focus and strategies that will prevent the event from ever happening, such as giving vaccines. Secondary is quite different. Secondary prevention is a strategy focused on decreasing the negative effects of an event, such as teaching students to wear a bike helmet or putting airbags in cars, those kind of things. That's a secondary prevention that's preventing the injury after it occurs, the accident occurs. So by very simply educating somebody to wear a helmet or putting airbags into a car. So as an EMT, you may be called to assist the community, especially in disasters. I've lived in Florida. I was born and raised here. Lots of hurricanes, fires, those kind of things. And, the community comes together to help one another. That's what we do. Also, unfortunately, we've had a lot of school shootings. So there's a lot of focus and emphasis on stopping the bleed. Put your hand on it. Tell somebody to go get the stop the bleed kit off the wall. Use a tourniquet. These things, if you were not trained on them already, you most certainly will be trained on as an EMT. Review. All right, folks, we're going to do a review. We're going to talk about the questions that you're going to see. I'm hoping on the end of each one of these lectures that I give you some information that will help you be successful in your test. So let's read this. Which of the following is an example of care is provided for using standing orders? Standing orders. Remember standing orders. What are standing orders? Standing orders is offline. It's something that you have, right? So take a second and take a look at these and tell me what you think they are. I'll give you about 10 seconds. Do, 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 do. Oh, by the way, you'll be getting Kahoots that are very similar to this as well, where you guys can compete against one another. Okay, what do y'all think it is? All right, here we go. It is B. Okay, standing orders is a form of offline or indirect medical control. You're not talking with anybody, so it's offline. Okay, offline. You will see this as a test question. Be prepared for it. So the other stuff that proves it's not, okay, medical control is contacted by EMT after the patient with chest pain refuses. Well, they had to call. So that's online. EMT defibrillates the patient in cardiac arrest, begins CPR. That's treatment, okay? That's treatment, and it's based on standing orders. You're told this is what you do if a patient's in cardiac arrest. So that is absolutely, absolutely a point of using standing orders as an offline type of project, and this is it. See, a physician gives the EMT an order via radio. That's definitely online. It's on the radio. Following an overdose, the EMT contacts the medical director. See, each one of these A, C, and D, you're doing something to talk to somebody, the medical director. So that's all online, and that's not standing orders. Standing orders is offline. Very good. All right, number 2, quality control in the EMS system is ultimately the responsibility of, so quality control, paramedic, lead EMT, the medical director, or EMS administrator. What do you guys think? Come on, think about it. Who is the ultimate king poobah here? If you said medical director, you are correct. The answer is C. The medical director is king poobah. They are responsible for everything that EMTs and the paramedic does. Obviously, paramedic is not, the lead EMT is not, the MS administrator is not. The paramedic can direct you, but the medical director is the ultimate responsibility. And I want you to look at that, ultimate responsibility. That's your word. When you're looking at test questions, that's the kind of stuff you're looking for. That's number uno guy. Okay, so guy or gal. So ultimate responsibility is the medical director. Upon arriving at the scene of a domestic dispute, you hear yelling and the sound of breaking glass from inside the residence. You should immediately gain access to the patient, carefully enter the house and then call police. Retreat to a safe place until the police arrived. Tell the patient to exit the residence so you can provide care. Remember, scene safety, number 1. So the answer is C, correct. Never enter a scene where you think that your situation may endanger yourself or your partner. Just don't do it. Call for help. Make sure that you're in a safe area, and then wait until the police have said the scene is safe. There you go. Gain access. No, 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 no. Carefully enter the house. No, 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 no. Never, never, never. I love these nevers. Ooh, never, never. Never, okay, be clever and don't make sure you never do these things, all right? Retreat for safety, wait for safety to happen for you. Scene is safe. Which of the following is not a component of continuous quality improvement, CQI? This gets people. You see how that it's in capital letters? That means something right away. You're looking for the negative. So there is only one correct answer for continuous quality, or there's only one incorrect answer for continuous quality improvement care. The other 3 are correct and a part of CQI, okay? So you look, review of run reports, okay? discussion of needs for improvement, negative feedback given to those who make mistakes while on a call, remedial training as deemed necessary. So what do you think? What do you think? You give periodic reviews in CQI? Yes? Okay. Discussion for needs of improvement? That makes sense. You give negative feedback to people? You really are lousy. You're terrible, terrible. I think that's one that we could say that is not. So that would fit this big old word up here. Remedial training is deemed necessary by the medical director. Yeah, that's part of CQI. So the answer has got to be C. Okay, C. There you go. Those are all part of the CQI, A, B, and D. And so C is not. And don't forget, if you see those capital lettered words, okay, pay attention to that. Make sure you answer the question correctly. Can't tell you how many students I've seen that screwed this up. Don't be that person. All right, all of the following are responsibilities of EMS medical director except. So there are 3 things that are the responsibility of medical director and 1 that is not, the exception. Evaluation patient insurance information? That doesn't sound like what a doctor would do. Serving as a liaison to the medical community? Yep. Ensuring that the appropriate standards are met? Yep. Ensuring the appropriate EMT education and continuum training? Yep. So this one is the exception. Okay, remember, except. There's that big E. Okay, there you go. Answer is A. Perfect. There you go. All right. Which of the following situation would most? Oh, I hate these. But notice it says most. Most is like all. When you see all, when you see a big ALL, most means numero uno. So there's only one, and all the rest of them are wrong. There is one. Which of the following situation would most likely disqualify a person for EMS certification? A misdemeanor committed at age 17. Well, first off, it's a misdemeanor, and it's a juvenile. Driving under the influence of alcohol? Ooh, that's probably not a good one because guess what? As a responsibility as an EMT, you have to drive. And if you have a DUI, you're going to have a hard time convincing the state or somebody to work for to hire you. Possessing a valid driver's license from another state, yeah, that's no problem because you can transfer it. A mild hearing impairment that's corrected with hearing aids, notice the word corrected, that makes it okay. So the answer is yes, B. Absolutely. DUI is going to really mess you up. Okay, tells you right there, gives you the answer for B being the most correct answer. And that's why I like to say, eliminate the ones that are absolutely wrong. So you have one that's absolutely right, so that means there's 3 on there that are absolutely wrong for this particular question. Which of the following should an EMT be the first priority? Controlling severe bleeding, maintaining a patient's airway, ensuring patient safety. Boy, if you automatically chose A, better think about that because what is the number 1 consideration in the 5 points of the assessment? It is scene safety. 5 points of assessment. The first one is scene safety. Second one is your primary survey. The third one is going to be your history taking. After that, it's your secondary assessment. And then finally, your reassessment. 5 points of the assessment. You've got to have that for structure. Okay. There's some ambiguity about the last 2. Some people are moving secondary to the bottom and reassessment up to the top, which makes sense if your patient's critical. Okay, because you may not have time to get to a secondary survey. But we'll talk about that in class. But scene safety is number 1. Don't forget that. There it is. Okay, personal safety, scene safety. There's the reasons. Okay, a patient who requires cardiac monitoring. So putting a cardiac monitor on somebody and needs it, needs to be put on and then, absolutely watch them and monitor them, that kind of thing. In the field, which one will require that? A minimum of what level of EMS clinician? EMR obviously is that first responder. He only has 40 hours worth of training. That's a week, 2 weeks at most. 40 to 80 hours. An EMT, which is you guys. Okay, you guys monitor a patient. Sure, you can put the monitor on the patient, but you can't tell what's on there. You're not trained to do that. A paramedic, oh yeah, he's the highest level on this list. And then an EMT, which can do some advanced skills, but not cardiac monitoring. So if you chose C, you are correct. Absolutely. And here's the reason why. Okay. So know these. These are all test questions. Let's do another one. Which of the following professionals is a professional responsibility of the EMT? Telling the family of a dying patient that everything's going to be okay. Maintaining only the skills that they feel uncomfortable with. I think we can eliminate the first two. Maintaining a professional demeanor even in the most stressful situations. Oh, that sounds pretty good. Advising an emergency department nurse that the patient reports are given only to a physician. Nurse, I cannot give you the report. Only a doctor. Yeah, she might toss you out on your ear. So, the best answer on this one, we've eliminated A, B, and D. The answer is C. They rely upon you to remain calm. When chaos happens, mistakes happen. So when you walk into a scene, no matter how chaotic it is, one of your number one jobs after scene safety is to make sure that we calm things down and we do things in an organized manner. There's the reasons why. Okay, let's do another one. 10. Emergency patient care occurs in progressive phases. What occurs first? What occurs first? Activation of EMS, initial pre-hospital care, the patient receives definitive care, or incident recognition. What do you think? If you chose D, you are correct. Incident recognition, somebody's got to recognize that there's an emergency first and dial 911. That's the first phase of the call. Without that, nothing happens. All right, so there's the reasons why. I want to thank you guys. This has been great. I hope this was helpful for you. We'll be doing more of these lectures. I hope you appreciate what we're doing here. And I want to tell you that if you have any questions, give us a call.